question, I believe it is necessary to recognise that when practicing as a nurse, patient safety must come first. As graduate registered nurses, we have been equipped with the knowledge on how to achieve this. An example of this is providing advocacy for our colleagues, patients, and ourselves. As in the NMPA Standards for Practice, Standard 2.5 states that we must advocate on behalf of others, making advocacy as a graduate registered nurse highly important. To ensure this as a graduate RN, a leadership role must be undertaken whilst ensuring to stay within my scope of practice. Therefore, I believe that patient safety comes in hand with the type of work environment that is present on a ward. A busy medical ward, there may be times where patient safety is overlooked in order to get things done quickly, but this should not be the case. As a graduate RN, it would be my responsibility to advocate for my patients by advocating for the work environment that I am in. An example of this is the staff skill mix. Ensuring that there is adequate and equal steves among the nursing team is imperative for patient safety. If I believe that there is not a good skill mix, I will be speaking to the NUM to address the skill mix. As a registered nurse, I will need to have experienced team members on the shift to support my learning and to facilitate my training. If I advocate for this correctly, there will always be an adequate skill mix on shift, or I will work towards gaining better training for myself to ensure a safe work environment. Secondly, an example of workplace advocacy I will engage in is medication safety. Any medication administration that is not safe must be reported immediately, as it puts our patients at a high risk of adverse outcomes. It is my role to advocate for my patients and colleagues, as unsafe medication administration put others at great risk. For example, medication safety issues can stem from little things such as illegible handwriting, and although it seems like a small issue, it can cause harmful events, and there should be no room for interpretation. To avoid these issues occurring, a plan should be put in place and should be advocated by everyone on the ward environment. If this is followed, a decrease in medication safety, adverse events, and an increase in advocacy will be seen. Both examples of these advocacy in the workplace and workforce will facilitate a safe environment for our patients and our colleagues.